My name is Ava English, and for this study, I focused on inclusion in an occupational therapy setting. I observed an occupational therapist evaluate a 58-year-old male who had his lower right leg amputated. Throughout this study, I focused on the occupational therapy profession and how within this profession, the functionality of patients' independence in fulfilling their goals starts with inaugurating an inclusive environment and proactively incorporating universal design within their therapy services. The inclusion focus was amputations. An amputation is a surgery to remove all or part of a limb or extremity. His ability to ambulate became harder, his simplistic task in his daily life became more complex, and learning to rely on his compensatory use of his remaining faculties increased. For my prior research, accessibility contributes to an inclusive environment for all patients because it is a universally designed environment to access and use. This does not just include the physical spaces of the environment, but it also acknowledges the performance of the therapy services being provided while being proactive against external barriers. Assistive equipment such as larger stalls and bathrooms, adding ramps leading into buildings, and creating the space needed in workspaces that meet the needs of a person's disability are all examples of accessible designs which were used throughout this study to ensure an inclusive environment. Inclusion is the practice of including and accommodating people who often face discrimination and exclusion due to their limitations caused by their disability. Organizations have failed to represent people of all backgrounds and disabilities. Studies show that increased inclusion and diversity representation within a hospital setting increases the patient-practitioner relationship, more positive client outcomes, and increased access to healthcare services. Listening and engaging in conversation contributes to a better processing outcome for those with disabilities. They are able to verbally communicate their concerns with specific practices, voice their opinions on devices they use, and explain the way they are feeling physically and mentally. The observation took place on March 13, 2024. It was set up to observe direct patient care at a Northeastern hospital on a patient who has a mobility disability. The occupational therapist performed an assessment while I observed for 2 hours. During the observation, I focused on inclusion, the equipment used during this practice, the adaptive devices, the physical space of the room, the ways it was implemented through communication, and the therapy services being provided. I took notes in a notebook throughout the entire process and was attentive to the services provided. For the assessment, the occupational therapist performed 3 different tasks during the assessment: a wheelchair transfer to the bathroom, assessing the patient's ability to dress himself, and assessing his ability to perform grooming independently. A deductive thematic analysis is where themes are derived using pre-existing theory, framework, or other focus. During this evaluation, there were 3 main codes that were discovered, which included communication, physical space, and focus. These themes were derived from prior research and made evident throughout the assessment process. Communication was used to transfer information from the occupational therapist to the patient or the patient to the occupational therapist. Physical space is a vital theme in occupational therapy settings to ensure the safety in all environments of the patient's life. And focus was to ensure the safety of the patient by focusing on the instructions given as well as the patient's mental state throughout the process. Themes are important because they focus on the patterned responses and are an abstract answer to research questions from data. The first theme was communication. Communication was the most salient theme throughout the observation because it helped the occupational therapist conduct the best treatment plan for the patient, as well as actively portray inclusion by listening to the patient relay information on how he was feeling mentally, physically, and emotionally throughout the evaluation. Communication was also important for taking field notes. Theme 1 was supported by prior research. Listening implies not only hearing the actual words, but understanding the nuances of communication. We have learned throughout our course that all people benefit when individuals with disabilities have access to opportunities that meet their needs. Effective communication would help benefit all therapists and their patient to prevent language barriers. The second theme was physical space. There are 3 physical environments he needs to adapt: the hospital and rehab facility, his personal home, and the high school he works at. Incorporating universal design within the physical environment would be incorporating ramps, doors wide enough for a wheelchair to fit, toilets and showers designed for handicap accessibility. Theme 2 was supported by prior research. Studies show that creating an accommodated environment to the patient's needs can influence the healing process. During the evaluation process, I noticed that when performing the wheelchair transfer process, there was enough physical space and equipment used to safely perform the transfer, which reduced the patient's anxiety. The third theme was focus. Focus was an important theme in this observation. Focus allows for the proper management of assistive devices and equipment to follow through with tasks safely. Attention is also related to the confidence, motivation, and the process of development towards the patient's future goals. Theme 3 was also supported by prior research. In previous findings, I found that focus is not only important amongst the patient, but within the practitioner as well, by allowing the therapist to understand the patient's perspective to meet their needs. It has been discovered that therapists can build relationships even within a very short-term service by listening and focusing on their patient's concerns. Throughout, these 3 themes have displayed prominent factors of universal design in a hospital setting by implementing proper communication, a safe and accommodative physical space, and a focused client-practitioner relationship within an occupational therapy environment. The first recommendation for inclusion would be occupational therapists should prepare guidelines for adaptive clothing options for clients. Occupational therapists give assistive apparel devices such as sock and stocking aids, long handle shoehorns, and lower extremity dressing aids while in the recovery process. The principal flexibility in use would be the design, which accommodates to his individual preferences and abilities on how to complete this task. It is the key principle that aims to provide users with choices, which allows them to adapt to their personal needs and preferences. This would improve inclusion by allowing self-expression to be adaptive and designed to specifically meet the needs of individuals with disabilities or mobility challenges. Implementing adjustable clothing that can be created specifically for them, whether it is for wheelchair users with sensory-friendly materials or easy fastening enclosures, adaptive clothing symbolizes universal design and inclusivity. The second recommendation would be improving safety in patients' homes. Occupational therapists should ensure the patient's safety in their homes by going over proper procedures that should be followed in cases of emergencies. For example, if a patient who uses a wheelchair falls, how to maneuver himself from the floor back into his wheelchair. Having someone come and check the patient's home to ensure patient safety is also recommended. This would make sure all equipment is installed properly, such as grab bars and other assistive devices and equipment. Based on prior findings, patient safety in home care is one of the most important challenges due to the high-risk nature of the home. The third recommendation is improving accessibility in workspaces and facilities. The patient works at a high school where the environment is well accessible and adaptable to students and individuals with disabilities. There are ramps to get into the building, buttons which open the doors to the buildings, wide doors in hallways, and grab bars in the bathroom, as well as handicapped stalls big enough to aid wheelchairs. The principle of universal design that is most suitable for this recommendation is simple and intuitive use. Simple and intuitive use is the use of design that is easy to understand regardless of the user's knowledge or experience. Because the school already is accommodating to universal design by having an accessible building, accessible bathrooms, and parking spots that are close to the building, it will be less challenging for him to adapt to his work setting. This would improve inclusion by advocating for the elimination of unnecessary complexity in design and emphasizing products that are focused on inclusivity and usability for everyone. The last recommendation is adaptive public transportation. For many patients with disabilities, transportation is a struggle. Mobility constraints are a major obstacle to disability-inclusive development. Providing adaptive transportation provides easier access to jobs, education, and other services. Universal design can be implemented in transportation by ensuring people with or without disabilities can safely get on and off public transport vehicles through the provision of wheelchair ramps, low-floor buses, elevators, escalators, priority seating, audible announcements, and other accessibility upgrades. This recommendation was derived from the patient I observed's life-altering accident, which limits his ability to drive a vehicle. Public transportation would allow him to safely get to his destinations. Reflecting on ethics, for the person, I learned that the patient was able to independently groom himself, dress himself with moderate assistance, and complete a wheelchair transfer with moderate to maximum assistance in the assistive equipment. For the environment, due to the American Disabilities Act, he was able to lead a normal life in a hospital and his area of work, which was a high school. For the situation, he was very involved in the school he works at, as well as the hospital he was staying at for weeks, and all his peers and staff members accepted him. Reflecting on efficiency, for the person, he wore the prosthetic devices that gave him assistance to reduce pressure from his leg, as well as make ambulation and prosthetic training easier for him. For the environment, he was given plans by the occupational therapist in cases of emergency at home, as well as assisted by staff members during exercises and wheelchair transfers to ensure his utmost safety. For the situation, he began to learn how to be his own advocate when completing the activity analysis. Whether he was independent or not, the support of the occupational therapist increased his trust in himself and her. Reflecting on efficacy, for the person, he had an adaptive equipment on his wheelchair, for example, a stump board, to help aid his amputation leg. In the environment, he was able to enter the hospital and school environments due to accommodations that were universally made for people with and without disabilities. For example, wide doors, big bathrooms, ramps, and buttons to press for the doors to open into the building. For the situation, he was welcomed into his work environment, but there was a lack of knowledge about the disability he dealt with. What I would do differently for this assessment, I would have focused on areas of independence first and then went into areas where he was not able to complete independently. This would have given him more confidence when adjusting to areas of dependency. The biggest takeaways that I learned throughout this study was that within an occupational therapy profession, the functionality of the patient's independence in fulfilling his goals starts with the priority of an inclusive environment. I learned that inclusion is crucial for patients' recovery process and adapting to life-altering disabilities, and for qualitative method focus on understanding people's beliefs, attitudes, behaviors, and experiences through the collection of analysis. I have learned specifically how to better observe patients and their accommodations, as well as how to properly take field notes during this evaluation. For my 2 discussion questions, the first being, if you were a parent of a child with a lower leg amputation, how would you ensure that they were being included in environments such as home, work, and school? The second being, how can non-disabled individuals support others with disabilities that may be visible or invisible in a hospital setting?